As an obstetric anesthesiologist, a question that I get fairly often is whether it is normal to feel like it's difficult to breathe during a C-section. This can be a normal feeling, but of course, there are things during delivery and postpartum that cause shortness of breath. We have to make sure that none of these things are causing this feeling for you. If someone in the operating room tells me that they're starting to feel like breathing feels difficult or they're feeling short of breath, the first thing I'm going to do is look at the vital signs on the monitor. So I'm going to make sure that the oxygen saturation is normal. I'm going to check the blood pressure and make sure that the blood pressure hasn't gotten lower because that can sometimes cause this feeling of shortness of breath. I'm also going to ask the mom to squeeze my hand to make sure that she still has a strong hand grip. The reason I do this is it gives me a sense for how high the level of anesthesia has traveled in the spinal cord. Our goal is to get it to thoracic level, kind of like the nipple line. The nerves that control your diaphragm, which is the muscle that actually allows you to breathe, come from the cervical spine, so C3 to C5. And the goal is never to have the spinal anesthesia be that high. If you start losing some weakness in your hand grip, that might be that it's starting to reach up into that lower cervical spine level. If that happens, and I do think the level is getting a bit high, we can put the head of the bed up to try to prevent that spinal level from getting any higher where it might start to reach the diaphragm, but that's extremely rare. Most of the time, this sensation is created because we also have these accessory muscles that are used for breathing that help with the breathing, the intercostal muscles, the muscles between the ribs. And there can be some sensory changes in those muscles. And so we don't have the same sensation, the same proprioception of feeling our chest kind of rise and fall that we would without that anesthesia on board. If I feel like the level of the anesthesia isn't too high and there's nothing else going on and the blood pressure is normal and the oxygen saturation is normal, I will sometimes give the patient some oxygen just to help her feel more comfortable, even if it's really not necessary. If you experienced this previously, one thing to know is this feeling is highly dependent on how high your level of anesthesia is. So just because you experienced it before doesn't mean that you'll necessarily experience again. It's something that you would want to tell your anesthesiologist about so they can look and see what kind of dose you got for your spinal anesthesia previously to see if that might be altered in some way so that your level isn't quite as high as it was the last time.